Hi, I am Dr. Lokesh HM, gastrosurgeon at Narayana Multispecialty Hospital. Today we will talk about esophageal cancers. Esophageal cancers usually present as dysphagia, means difficult to eat or something which is stuck in the when you eat or when you eat mainly the solid foods. So that time when you feel some stickiness in the chest or you need to drink something, so then we call it this as an dysphagia. So this is the primary symptom of any esophageal cancer. Esophagus is a tube structure. So when there is a tumor, so it obstructs the food which is going inside. So that causes the dysphagia. How to diagnose? The diagnosis will be done by endoscopy, a simple procedure through which we see what's going on in the esophagus, and we take a small bit from the lesion. So that will call it as biopsy. So that will decide whether it's a tumor or not. So in the tumor, again, there will be two types, the squamous cell and adenocarcinoma. Depending on that, the treatment protocol will be different. And once we diagnose this is a esophageal cancer, then we stage the esophageal cancer with a CT scan or a PET CT depending on the patient's requirement. And once we stage the disease, and when it's not spread across and it's limited only to the esophagus with some lymph nodes, then we can treat this with the combination of chemotherapy, radiotherapy and the surgery. So usually for a squamous cell carcinoma in our hospital, we follow a protocol of preoperative chemotherapy and a radiotherapy so that the bulkiness and the lymph nodes will reduce, and next the patient will go for surgery. The surgery will be done with the minimal access surgery. The thorax part will be done with a thoracoscopic method with a few 3 to 4 holes. We release the esophagus, take up all the lymph nodes around the esophagus. We come to the abdomen, we create a tube from the stomach. So that tube will be replacing the esophagus and will take up to the neck, and we join the upper part of the esophagus and this stomach tube in the neck, and the esophagus will be removed. So the patient will not have an open chest wound or an open abdominal wound. Maximum he will have a small neck wound to join the gastric tube and the esophagus, so that patient will be cured of the esophageal cancer. These kind of patients will lead usually the normal life, except few dietary habits changes will be there, that will be usually explained to all the patients.